So coronary calcium scoring is really one of our new weapons in trying to detect heart disease early and initiate prevention. And there's been some skepticism about it, but now it's realised that it's an incredibly powerful tool. I talked earlier about how calcium gets into the arteries, as it does anywhere in the body when there's an inflammatory process. And you can't see this calcium on a conventional X-ray. With the right equipment, you can not only detect the calcium in the walls of these little arteries in the heart, the coronary arteries, but by using a sophisticated computer program, you can build up a coronary calcium score, and that score can be matched against someone else in a normal population, matched for age and gender. So you can see exactly where you are. Are you average? Are you better or worse than average? And the coronary calcium scoring has taught us an awful lot about our conventional approach to risk stratification. We use age, smoking, the presence of diabetes, blood pressure and cholesterol. And we have this herd approach to risk stratification. So you go into a surgery and a general practitioner who's trying to see a patient quickly in a very crowded clinic will look up the table and look at your age and whether you're a smoker and say, well, yes, you've got a 10 or 8 or 12% chance based on group data of having a heart attack in the next 10 years, so take this pill or don't take this pill, depending where you are. The calcium score enables us to look at an individual's risk, not regard them as part of a herd of patients. And we can, if they've got a calcium score of 0, even if they've got risk factors like smoking or family history, then they haven't got the disease. Provided, of course, we look at them at the right age. In the younger patients, it's not quite so accurate. But say a male over 50, or a woman over 60, it's incredibly accurate in saying whether you've got the disease or not. And it's been well shown that when you plug the calcium score into the conventional risk tools that we have, you can alter a person from being a low risk to an intermediate risk or intermediate risk to high risk. And there are several publications that show that the calcium scoring allows us to target much more accurately the preventative approach with statins, for example, than using the herd approach on its own.